Delighted to be joined by Adrian and Bernie from NeuroResponse, who are going to be taking us through a bit of a presentation around urinary tract infections and the work that they're doing to help tackle that. At the moment, very London-based but growing, and the MS Society is really thrilled to be partnering with them on their work. I'll hand over now to Adrian and Bernie, who will take you through the presentation.
Hi everyone, good evening. Thank you for taking the time to join us today. I'm thrilled to be sharing with you the NeuroResponse care pathway, but a bit about our bladders as well. My name's Adrian Russell. I'm the clinical lead at NeuroResponse. I'm a physician associate as well with 5 years plus experience in the world of neurology. I work at Queen Square and I've worked also at Charing Cross Hospital in the past as well. Also on the call is Bernie Porter. She's the CEO and founder. I'll let her continue.
Well, hi folks. I see a lot of friends here tonight. Hello, everyone I know. Yes, so I'm a nurse consultant, over 25 years experience in MS, mainly at Queen Square. And as Adrian said, I founded NeuroResponse. Was something that was co-designed with people living with MS and other people in the MS community. And I'm delighted that Adrian has joined me in the team and he's going to be leading the presentation tonight. Nice to see people.
Thank you, Bernie. Right, so I'll just go quickly over what the session will be about. So the first part is, about the bladder itself and how it's affected in MS. How to look after your bladder really effectively and how we can mitigate urinary tract infections, and about how urinary tract infections can sometimes present in people with MS. We'll have a quick stop for some questions, and then following that we'll talk about how NeuroResponse came about, what the service offers and how to sign up, and then to take more questions at the end. And we should aim to be finished around 7:30, but we've got the session for a bit longer than that if needed. So the urinary system. I'm going to be playing a series of really useful tools and videos which actually were created by Bernie some while back, but they are still excellent, and they go over the urinary system in great detail for people with MS and other users. And I think it's really important this is how we work in medicine. We need to understand the actual system first, the urinary system, and then we can understand how it is affected and how we can best tackle problems that arise. So first of all, just about the urinary tract system, I've got a short video here to explain exactly what that is.
Welcome. In the following chapters, we'll be sharing some top-line information about the bladder, UTIs and your MS. In this chapter, I'm going to talk about the bladder and how it's controlled by your brain and spinal cord. The kidneys are the organs in the body that create urine. When the kidneys have created urine, they send it to the bladder, which acts as a storage depot. You may not know that the brain and the spinal cord are the command centre for the bladder. The bladder stores urine and it empties when it receives messages from the brain or spinal cord, or it holds on to the urine until it's a convenient time to empty. The bladder is made up of a smooth muscle similar to a balloon. The bladder has a capacity and it's got a neck. This neck opens into a tube called a urethra. When the bladder contracts, it sends urine to the urethra, which in men is the length of the penis. In a woman, the urethra is shorter, so it's easier for bacteria to travel up into the bladder. As the female urethra is near other body parts, such as the anus and the vagina, there's more chance of bugs transferring from one area to the other. Whilst it's more common for women to get UTIs, if a man thinks they have a UTI, they should speak to their GP. The GP may request some investigation to rule out other non-urological causes. In the next chapter, you'll find out about how MS affects your bladder.
So there's a bit of a background about how the bladder works and how it can be, and now we're going to move on to how MS affects the bladder. And then I'll go into talking about the different types of bladder problems and how it's important that we understand the different types of bladder problems, and then, you know, what sort of symptoms come around from those. So here's another short video about MS and the bladder.
In this chapter, I'm going to talk about how MS can affect bladder function. The bladder can vary in capacity, but most people can easily hold on to 400 mils of fluid. That's about 2 cups of water. The bladder can hold that, or even more on occasions, before it will receive a trigger message to suggest that it's full and would be a good idea to go and empty it. As MS affects the signals from the brain and the spinal cord, it stands to reason that if it sends a disjointed message to the bladder, then you will know about it. If the message comes too early or too late, you may get urgency and you may not get to the loo on time. If the message tells the bladder that it's empty when actually it's full, you may be retaining urine. If the message tells the bladder that you need to go when you've just gone, which is often known as frequency, then you'll be in the loo quite often. And of course, being the central nervous system, sometimes it can send random messages and even send both messages at the same time. And that can make it very confusing. In the next chapter, you'll learn about urinary tract infections and some tips for good bladder management.
So the problems that we normally, as medical professionals, like to label them are storage problems and emptying problems. And so for you guys, it will be you know, how well we can actually store the urine, and if there are problems with the tube that comes out, the urethra, which was mentioned in the first video about the muscle contracting, and how well we're able to keep that in. And if sometimes the brain can send off these random signals that create all these different symptoms you can see on the screen. So for instance, in the storage section, we've got frequency. I'm sure you guys know what that is. So the frequency is the going to the toilet more often than usual. Urgency is to do with how quickly, so you suddenly get a message that you need to go to the loo, but you don't have the time to quickly go to the toilet, and sometimes it may lead to an accident. Nocturia is the medical term for peeing in the night time, and actually in most people it's fine, but some people might get issues with being actually woken up at night to go to the toilet, and then incontinence. So there's problems with the actual storage mechanism in the bladder, and this can lead to different types of incontinence. So stress incontinence is where, for instance, if you sneeze or you cough or you laugh, there's sometimes there might be a little bit of an accident after that. And then we move on to emptying problems. So retention is where you're obviously holding on to lots of urine, and there's the inability for it to pass. A poor flow and a weak stream, also another symptom. So because that muscle isn't relaxing, when you are able to pass something, it's under a lot of pressure, and it's really difficult to get a good stream out. And sometimes the messages from the brain are not being transmitted very well and cause incomplete emptying. So this is where you think you've got rid of all your urine, but actually there's still some left in the bladder. And this is really important, because when urine is left to sort of stagnate in the bladder, this is when the risk of urinary tract infections can increase. And then intermittent flow is when you don't get a continuous stream of urine, but you get an intermittent flow. And again, this means this is a problem with obviously emptying, and then the retention of urine in your bladder, also increasing the risk of urinary tract infections as well. And then straining and hesitancy. It's really important for both types to be taken care of, but it's also important to identify the type of symptoms that you have, because health professionals can give you different treatments depending on what sort of symptoms you are getting. So looking after your bladder, let's think about what we can do. So bladder training exercises like pelvic floor exercises are the sort of first line of treatment, which we usually offer for bladder retention issues where you're having difficulty passing the urine, so holding on to the pee. And then this is also, we can have difficulty during the day to ease that strong need of feeling like you need to pee. And it's usually taught at bladder services, which I'll talk about shortly, but also by continence nurses and physiotherapists. And your MS nurse or your neurologist can also recommend medicines that help with your bladder problems as well. There are medicines that block signals from the brain to the bladder, telling it to squeeze and empty as often as possible. And then these drugs are called, you might have heard of them, antimuscarinic or anticholinergic drugs, or sometimes we just call them like oxybutynin or solifenacin. These are all medications which are used to help with the overactivity of the bladder. And then there are some more sort of second line treatments available as well. So electrical nerve stimulation, which is where a mild electrical signal is sent to the nerves that affects the bladder. And you might have like a small battery powered device which you keep with you. And when you think you need to go to pass urine, you would press a button and then it would help your bladder contract to get rid of the urine. Botox is often a very last line type of treatment, but again, Botox is a medication which is used to relax muscle. Part of your bladder, or all of your bladder, is surrounded by a muscle. So if we inject that muscle and relax it, it actually helps it to stop being so overactive. The downside to this, though, is you have to then start learning how to self-catheterize or intermittently self-catheterize, because your bladder might be relaxed to the extent where it actually needs help to get rid of the urine. And then finally is the tibial nerve stimulation. This is a really last line treatment where you have like a small electrical pad or needle, and it's usually applied to the side of the nerve, so on the skin, and it usually sends up an electrical current. This is not normally something you take home with you. You go to a treatment center to have this done, and you'd have it in a session usually once a week for about 30 minutes, and that's usually for 3 months. Then afterwards you should have sort of a relaxed bladder, so stopping you from going as frequently as usual. So I've done a little bit of a map about some services around you. There will be a copy of this presentation at the end of tonight, but essentially, if you haven't already got in touch with your bladder, and it says and bowel services because they usually come as one, but it's important, if you think you're getting urinary tract infections and your bladder hasn't been investigated already, there are definitely services out there that can really help manage your bladder and put you on hopefully the right treatment as well. And so we've got some links here for each borough in North Central London. So the next slide is about what we can do, other sort of self-management stuff, bits and bobs we can do to try and help mitigate a urinary tract infection.
In this chapter, I'm going to talk about how good bladder management improves quality of life. Urinary tract infections occur when part of the urinary tract becomes infected, usually by bacteria. For a person with MS, an undiagnosed or an untreated UTI may worsen their MS symptoms. We can't prevent UTIs 100% because we're not exactly sure why they happen, but you can try to minimise how often they occur. One key thing is to keep your urine as diluted as possible. You can do this by drinking water, at least 1.5 litres a day. You should avoid excessive fluids that are irritants. We all have a drink of alcohol or a cup of coffee, but make sure you drink water alongside them as they can irritate the bladder. You should also try to keep your bladder as empty as possible. If you've been told that your bladder is going to hold on to urine and that intermittent catheterization would be useful, then you should try to do this, because an empty bladder equals less chance of bugs growing. You should try and keep the area clean, because this will reduce your chance of infection. And one for the ladies. Remember, if you're sexually active, use tampons or wipe yourself in a hurry. Bugs that live harmlessly on the skin or anus may get into the bladder through the urethra and cause inflammation and infection, commonly known as cystitis. This type of infection is from more local activities and is not caused by nerve signal dysfunction.
So that's UTIs in a nutshell. So, you know, it's important to note that people with MS, you know, may get those classical urinary symptoms that we talk about in infection. So there may be some burning, there may be some stinging, the urine might smell, the blood, there may be blood present in the urine, and the urine might be cloudy. But more often than not, actually, we know that the people that we've worked with before, that actually they don't really have these symptoms, and often will just feel generally unwell in the absence of like a fever, for example, and actually may have worsening of your existing MS symptoms, or even trigger some new symptoms. And it's important to note as well that dipsticks as well, they are useful for kind of quick testing, but they're only as good as the person using them, and they're not always as accurate as well as we'd like them to be. You know, they're good for telling us if there's an infection present or not, but they're not very good at telling us, or they don't tell us at all actually, whether or not what type of bug is actually causing that infection. So the gold standard is what we say in the medical field, is the gold standard for diagnosing a urinary tract infection is to send off that urine to the lab. And that's to test it and see look at it under the microscope, look exactly, the clever people in the lab can see what type of bug is growing. They can put it on a dish and then see what type of antibiotics are going to work against that bug. And then that helps guide us as clinicians who treat the infection about what type of antibiotics will be best against that bug which we've grown. So the last bit is about how the bladder is affected in MS and how it can often mimic relapses.
In this chapter, I'm going to talk about how urinary tract infections should be diagnosed and treated. Urinary tract infections in MS can sometimes be silent. A person with MS might not have any visible symptoms. Often for a person with MS, a UTI may make them feel generally unwell. They describe feeling off, being tired, and they may not be able to put their finger on it, but they know that something is brewing. The first few times you're told you have a UTI, you may be surprised, but people who've had a few infections start to know well in advance when something is about to start. If you're about to develop a UTI or you think you have an infection, it's important that you feel confident to seek advice. The health professional may use a dipstick. That will help tell if there's an irritant bug in the bladder. They may ask you to send a midstream sample of urine. That can help tell exactly what the bug is and the type of antibiotic you need to be given.
Sorry, now we're moving on to the MS relapses and in UTIs.
In this chapter, I'm going to talk about how MS relapses and UTIs often occur together. People with MS can have a relapse and a UTI at the same time, and it's hard to know which has come first or if there's any relationship between them. We know that about 50% of relapses are preceded by infection, so a UTI could, in theory, cause a relapse. But we also know that relapses can cause missignaling to the bladder. A relapse can change the messages going to the bladder and change the bladder's storage or emptying function. This might lead to the development of a UTI. If a person has an aggressive UTI which causes fever and lots of signs of very active systemic infections, then it makes sense that it would be a priority to treat, and so antibiotics would be the first step. But often people with MS have a urinary infection that has not caused a fever or had any major effects on the other systems. And if that is the case, you can treat the relapse and the UTI at the same time. So, if required, you can have steroids and antibiotics together. In the next chapter.
So that's UTIs and MS relapses, the key takeaway from that video is that relapses can occur at the same time as infection. But it's important that you're aware that other types of infection can also be a trigger for a relapse as well, like a chest infection, for example. And so if you are having a relapse, it's really important that or you think you're having a relapse, it's important that you speak to your healthcare professional really quickly, because it helps us work out whether or not you have a relapse or an infection or both, and put you on the right treatment quickly. Just a note that obviously in the pandemic, we were a bit worried about giving steroids alongside antibiotics, but I now can confirm that we are now resumed that treatment again. So just speak to your healthcare professional and they can advise you if that's indicated for you guys. The idea behind NeuroResponse started from an audit, and Bernie was the driver behind this, and it was a few years back now, and basically the audit was looking at reasons for why people with MS were turning up to emergency departments, and these were unplanned reasons for turning up to emergency departments, not planned stuff. And so we were trying to figure out what on earth is bringing all of these people to the emergency department. And as you can see on this graph, we can see that urinary tract infections are by far the most common cause for people with MS coming into emergency departments unplanned. And just to highlight that all of this work was done pre-COVID, where behaviours of the NHS and the people using services were very different. And so, if anything, the pandemic has actually made NeuroResponse an even more relevant service, and you know, creating digital solutions for people being more at home these days. And so, by far the most common reason was UTIs. And so, you know, we looked at what is the issue here. So we know 130,000 people live with MS across the UK, and we know that often out of hours care is really fragmented, where, you know, it's Friday night or Friday at 5 p.m. or it's Saturday, and you suddenly think you're getting a UTI and you don't know, you can't call your GP because they're shut. You know, it's really difficult to get that clinical advice out of hours. So we knew that that was a really significant problem for people with long-term neurological conditions like MS. And this, in 2019 and 20, this sort of disjointedness unfortunately resulted in around 14,500 unplanned admissions to emergency departments because of just UTIs. And imagine, you know, that's a huge spend on the NHS, and imagine where that money could have been spent instead. We could have invested it in more, you know, MS-centered treatment. And, you know, this doesn't even include the cost to you guys and the carers and the families involved in the care. And so we know this is a real big problem across the system, and, you know, NeuroResponse was here to try and come up with some solutions. And so we visited people with MS in their homes, with their consent, of course, to understand exactly what happened from their individual perspective. We asked them, you know, you were in A&E recently, can you tell us about the days before and how you ended up in A&E? And then we listened, you know, really important. And people told us that the system was broken, that they talked about that they had this really poor access to GPs, especially out of hours, not being listened to, and just being given a generic antibiotic, which they probably were resistant to, and they knew it wouldn't clear the infection. And then we brought representatives of across the system from, you know, the NHS, and put them around the table. So, for instance, we've got the MS, people with MS, their carers, their families. We've got audiologists as well, like the microbiologist, the pharmacologist, and we've got the GPs, and then key commissioners across the system. And we shared the audit findings, which I showed you earlier, and we captured what they said. And we asked them to imagine, what would a perfect system that was built for people with MS look like? What would you have that could give you peace of mind that you could get treatment at home, or to treat your urinary tract infections, and hopefully stop you from having to go to A&E unnecessarily? So in order to understand what was broken in the system, we sent out people, MS nurses went to interview the people with MS in their own homes and their families. And we also spoke to GPs and neurologists, continence nurses, to hear about their experience of managing urinary tract infections. And 5 hours of film was captured, and with consent, obviously, and key themes were analysed and captured from the findings. And here they are distilled down into 4 sections. And so, what did people with MS and their carers and families say that they wanted? They wanted access to expert advice day and night. They wanted short waiting times and assessments for new MS symptoms. They wanted to make urinary infection analysis treatment faster and easier than it currently was, not having to rely on a GP to prescribe it when they might be really busy, and creating a secure system where obviously all of the data is held securely. And so what were we able to look at and sort of create from this? So from this, we've established that the ideal components that we would need is a service that offers 24/7 access to advice, the ability to have a care plan so that when someone with MS calls through thinking they've got a UTI, they have a care plan that is recognised, and the person that they're on the phone to can see this care plan and recognise that, okay, they're on Neuroresponse, here's what to do next. They wanted a kit to keep with them at home so that they could send off a sample to the lab really quickly. They wanted what we identified is that we needed the ability to collect that kit safely and then transport it to the lab, and then messaging across systems. So we needed the 111 systems to actually communicate with the GP setting. And then making sure, of course, that all of our data is held in a secure environment, which is very relevant these days. And so we created Neuroresponse. Here's our video, and it's only 2 minutes. I'll just start that off now.
Accessing support when you have MS and develop a UTI can be difficult. You may need to wait for an appointment to see your GP, or you may even end up in an emergency department. This can really impact on quality of life. That's why we created Neuroresponse, a new model of care co-designed by people with MS and their families to support them and their condition. Neuroresponse is a service that offers people with MS free 24/7 access to clinical advice to aid the early detection of UTIs and gets quick and easy access to antibiotics if required. How does it work? The first step is to set up a personalised digital care plan that links to your personal phone number. We can help you set that up if needs be. Once your care plan is set up, our laboratory partner will send you personalised urine sample pots in the post. If you think you have a UTI, just call 111 from your personal phone number and your care plan will be recognised. You will then be put through to a clinician for expert assessment and advice. Neuroresponse will dispatch a courier to your home to collect your personal sample, which is couriered to the lab, where an initial result will be ready within 24 hours, letting us know if you have an infection or not. After approximately 48 hours, the 111 clinicians receive the exact results and can electronically prescribe personalised antibiotics if needs be. Neuroresponse also follows you up after your course of antibiotics to see how you're getting on and can link you to other healthcare colleagues as required. Neuroresponse can have a positive impact on health, and feedback from people with MS is really positive. Neuroresponse, co-designing care pathways with people and families living with neurological conditions.
So there's the Neuroresponse pathway in a nutshell. And so just to take away the key points from there is that enable to access the service. So when you sign up, you get a care plan that's recognised. You prepare your urine sample because in the post you received a urine kit. you call NHS 111, and then your care plan is recognised. And then they'll ask you clinical questions and give you an assessment, collect your your sample from your home. That's delivered to the lab. 24 hours, we get an initial result letting us know if there's an infection or not. And then we can prescribe antibiotics and another 24 hours later based on what that test showed. And that's all kept secure. And this information is just shared with your GP so that they're kept in the loop. But obviously, if you prefer not for that to happen, then we can that can also be arranged. And so what do people with MS have to say? These findings were sourced from, so the UK MS Society in 2019 kindly commissioned an independent company called the ICF to look at Neuroresponse and interview people who have used the service, both families, the patients, as well as people in the system, like the clinicians. And I think the overarching theme amongst all of them is that it's the convenience that they love. You know, they can use it at any time of the day. They can it's especially convenient over the weekend, and they can just get their sample tested really quickly. I know I've you know, spoken to people before, and it's been really such a nightmare for a lot of them to actually get a urine specimen to their GP. And I think this just makes that Neuroresponse just that little bit more, makes it a little bit more easy to manage. And so who is behind the Neuroresponse team when you're on the phone? So obviously we've got the clinicians who support the service at NHS 111, but the actual pathways themselves are being made continuously by the you guys who have this invaluable lived experience of MS. And so when we're creating things, and the things that we have created, you guys are the experts in this condition, and we look to you for advice about what would work for you. I'm also there in the background trying to help navigate the pathway so that when the pathway is used, we can make sure that everything is going according to plan. And then we've also, we need to make sure that all the stuff that we do develop is clinically signed off as well, and we're supported by such an amazing clinical advisory board. I'll name drop a few people, but you might know Professor Jeremy Chataway is a world leading expert in MS and operates mainly at Queen Square. And then Prof. Jalesh Panikar, who's a urologist and has expertise in the world of the neurology and bladders combined. And a novel element of our workforce has been the establishment of these engagement officers. And these guys were recruited from an army of medical students who actually came forward during the pandemic and trained in NHS 111 skills. And their engagement tasks, basically, they're the guys who sign you up to Neuroresponse if you choose to join, and they just take you through all the questions needed. I'll explain a bit more about that in shortly. So where is Neuroresponse at the moment? So we're continuously, striving to improve. We have such amazing stuff on the horizon, which I'd love to share with you, and also which I will share with you very shortly. We're also involved in continuous education, training and development of our clinicians, and actually the materials that we use to create these are actually co-designed with people with MS as well. So really capturing the rich learning from you guys and giving that back to the clinicians so that they can understand how to help you best. And then I'd like to, I'm really happy to share that, our app Neuro is on the horizon. This app is going to be putting the pathway into your pocket, essentially, and improving the access to the service. So the idea is that you can order your own urine kits from the app. You'll have a few questions sent off. It just cuts out that little bit at the beginning. Of course, we need to make sure it's clinically safe, so we're still asking all the same clinical questions, but it's making it even more accessible on top of the existing phone service that we already offer. And so, yeah, this is a little snapshot of what that looks like. So excited that it'll be launching for you guys very soon. And if you're interested to learn more about that and maybe even help us test it, please let us know. We are more than happy to receive some help with that, and look forward to working with you. So if you are interested in signing up to New Response, this is how you can do it. You know, you can let us know on this call today if you'd like to sign up. But if you have friends and family who have people or know people with MS, please do recommend New Response to them. You can direct them to our website, which has all of this information on already, but here it is here as well. So we've got a voice message, an email, and our website, and that basically pings across a message to our engagement team, who will then pick it up and then register you. And just to note that the service is available across the whole of North Central London till at least March 2023, which is next March. What we're trying to work on at the moment is we're trying to look for ways that we can ask the NHS commissioners, the people making all those big decisions at the top, about, you know, we can see now that it's worked really well for people who have been using it now in Barnet, and now for all these other people with MS in Camden, Islington, Enfield and Haringey. You know, let's collect all that evidence and bring it back to those NHS people and then say, look, this is working really well for everyone here. Why not? Why can't we extend it even beyond March 2023? So, you know, that's a work in progress, and we're hoping to be able to do that. And then how do you register? So once you've contacted the engagement team, they will answer any queries for you. And then the majority of people will then go off and resend you a text message with a link in it. And that brings you into our online portal to register yourself. And that's how the majority of people sign up. But actually, we can also, if there are issues with that, we can then support you with registration over the phone, or in certain circumstances, we might even be able to arrange a home visit.
I wanted to say thanks to everyone in the community who have helped with this so much, because as Adrian described, the early days of some people may have been involved in that work. We did the Shift MS, there's like a blast from the past with the old overhead and the chapters about the bladder and stuff. But again, that was all done with people living with MS. All the work in North Central London after the audit, again, led by people with MS. The report from the ICF, people kindly participated in the talking to the researchers, and also in the app development, people like, I think I saw Sylvie here earlier, I might have seen her name, but there's people here that they've been really key, and we've been building, and so I just really feel that, and this is something that's been co-designed by all of us together. It's relatively new in the as a service as such, so there's obviously going to be tweaks and things that need to happen, and not everything has gone to plan. There's things we've learned lessons, there's things that didn't go as we all anticipated. We've fixed those, so it's a constant thing, but it really is a community effort, and I just want everyone on here to know that we really appreciate that, and this is this belongs to people, the MS community, because it was designed by them.
Thank you to Adrian and Bernie for not only the incredible work that you are doing to support people with MS around UTIs, but working together and seeing how we can kind of continue to promote this service and hopefully get even further more uptake and spread it. And thank you to everyone for joining as well.